Hello and welcome to the podcast studios. I'm here today as part of the Cancer Patient Series podcast that we're doing at the Gateshead Health Foundation Trust. We're here today to celebrate the Cancer Clinical Nurse Specialist Day, which is going to happen on the 26th of April. I'm joined today with Yvonne Anderson, who is one of our Macmillan Gynae Oncology nurses. We have Nealy Tate, who is one of my colleagues as a breast care nurse, and we have Claire Pounder, Macmillan lead nurse, cancer lead nurse. And today we're talking a little bit about celebrating that particular date, and it's a relatively new day that we've started to celebrate. Was it last year was the first one that went live? And it was a really massive success, wasn't it? It was one of the biggest tweet that was going on that day. It was.
Yeah, I think certainly I'm sure we were trending about 4 or 5 on Twitter for a period of time last year with all of the national Twitter
feed
that was going on. Yeah.
So why do you think there's been so much sort of attention when it's come to this day? Because it's getting much more momentum this year, and why do you think we've needed this?
I mean, obviously the National Cancer CNS Day last year originally came from the Greater Manchester Cancer Alliance, and they had recognised their recruitment and retention issues with their cancer nurse specialist workforce, and then that was shared nationally, and so there was a lot of other national organisations who were keen to get involved. So obviously Macmillan, UCONS, the RCN and NHS Health Education England were also keen to support the day, and that's how it evolved into this national day that we had last year that was really successful. And obviously it's recognising, the fact that we have got a cancer nursing workforce challenge, and how can we aspire the new nurses coming along for the future. So yeah, it's a great day to celebrate the achievements of the cancer nursing nurse specialist, and also recognising their contribution to the cancer patient pathway, which is fundamental and underpins a lot of that information and support that our cancer patients receive throughout their patient pathway.
Yeah, because I think we've just been away today, recently with an away day with the breast care nurses, and we were kind of celebrating what our role does, and looking through some of the data for that, I was aware of the impact, but not to the extent that the Cancer Patient Experience Survey was saying that the increase in survival of patients when they have that key worker is tremendous. And I hadn't really appreciated why, I know we do a great job, but the influence we have, and I think, us working on the core phase of it, we see it, we understand it. And I suppose maybe that's one of the reasons why you came into the role, when you understand that influence.
Yeah, I mean, certainly. So I started off working in a surgical ward, and I always found that the people who were coming through, so the people who had the likes of bowel cancer, breast cancer and stuff like that, you would say to them, you would say, who's your breast care nurse, or who's your, your cancer nurse? And they always knew who it was. They knew how they could get in contact with them. They knew that if there was any issues, that they were the first port of call. And we certainly, from a ward level, we kind of knew, okay, well, we know that their kind of aftercare is going to be looked after, because they had such a like a very deep kind of nurse-patient relationship, really, with their cancer specialist nurse. And I think that was certainly for me one of the big reasons of wanting to get into that type of role, is because you want to be that person who makes that difference for the patient. You want to be the one that they're able to come to, the one that they know that if they're unsure about anything, or if they've got any problems, or if they're worried about anything, I'll call my nurse, I'll call my cancer nurse, and I think it's a real privilege, really, to be in that position, to be that person.
I suppose it's delivering that expertise, and you've been delivering that expertise for many years.
Just a few. Yeah, and it's exactly, it's a privilege, and it's lovely to see patients going through, they call it a journey, I don't know what to call it, but actually when you see patients being empowered as well, and I think, they maybe don't need you as much, but that's good, because then you think, no, they're getting on with life, but then they always know that at the end of a telephone call, whatever that may be, it may be to do with the family, or my cat, my dog, it could be anything. Each day is very different. You try to have a plan, but it never goes to plan. And I think that's the exciting bit about it as well, isn't it? You just never know what your day is going to be.
Yeah.
I think you're right with it. It's that empowerment, isn't it? It's not about holding people's hands and mopping brows. It's about giving them that strong scientific evidence of, to help them with those decisions, because now, we're in an era where there's so much choice. And I think a lot of our job, and, Claire, you've previously been a clinical nurse specialist in bowel, it's that shared decision making, isn't it?
Yeah, and that's really, really important, isn't it, to be able to make sure that they've got all of the information they need so that they can be involved in their decision making about the treatments and what might be available. And obviously, as you say, it's really difficult, isn't it, sometimes, and quite a challenge to try and keep up with some of the newer technologies, the newer treatment options that are becoming available. But obviously, from a CNS point of view, it's really important that you're able to keep abreast of that and advocate for the patient, as part and parcel of their pathway.
Yeah, but I mean, because, what we deliver now, when I think of when I started the job, 17 years ago, it was kind of very standard chemotherapy regime, it was one or the other.
Yeah.
Whereas now, I know, Nealy, you've had quite a lot of input with aspects like genetics and the genomics, you have to be like mini scientists now to kind of deliver that information. But again, it's enhancing the role, isn't it?
It does, yeah, and certainly, I mean, from our perspective in terms of the genomics thing, I mean, that was it's like a national kind of program that they're doing to make genes and genetic testing part of the sort of normal pathway for any patient. So where it used to be that they were done in specific areas, like in terms of if you had someone who you thought would be suitable for genetics, then they had to be referred to, for example, the Centre for Life. Whereas now we're trying to bring it a bit more in-house so that it's just a normal part of the patient pathway, so that we can kind of make sure that nobody's getting missed, because it does happen sometimes, but we're picking them up much earlier. It means they're getting the results much quicker, and it means that if there's any if it's going to make any difference to the care that they're going to get, we know about it early doors, and so we're not wasting time. I mean, for example, certainly in breast cancer, people can avoid having things like radiotherapy and stuff, so it does have a big impact on not only the patient but their family as well, obviously, and the impact that it has on those around them, if they are kind of tested positive for anything.
I suppose it's that, again, comes back to that personalised aspect as well, and I know, Yvonne, you're really interested in that as well, because we can't do a cookie cutter for everybody information-wise. People like delivery of information in different ways, and you've had a particular interest in aspects of learning disabilities with that as well.
Yeah, definitely. And I think everybody should be the same. We should have the ability to have the information, whatever format that would be. People can communicate me via telephone, email, whatever. But I think what's particularly with the learning disabilities, or people who have difficulty reading, we do a holistic needs assessment, and actually there wasn't one available in learning disabilities. So we've been working with the learning disabilities team at Gateshead, and we've got a holistic needs assessment which will be coming out shortly for people with learning disabilities or find it hard to read. And this is important for all of us. We're all the same, we should all have the same rights. So as I get a bit passionate about it, but yes, so I'm really excited about this, and even getting some of the material now in easy read. So the prehabilitation stuff is in easy read now. A lot of our information is in easy read, and we've now got a specific site on the internet, Pandora, so people can access the easy read there as well.
And it's that inclusivity, isn't it? And making sure that it counts for everybody, and it's those portions of the population that sometimes don't do as well when they reach the cancer pathway, and a lot again that's because of information needs. We've had some significant issues with some of our patients who English isn't their first language, and getting hold of some of the translators for that particular language. So again, part of our role, I suppose, is innovation, it's keep moving it forward.
Definitely.
We've been looking at things like, looking at digital information, but we've even been looking at avatars where they can deliver 120 languages just by putting that patient's question in. It can deliver that, and it's again, us being at the forward of that innovation and steering forward, but having the likes of leaders who give us that psychological safety to try and test out these new ways of doing things.
Yeah, I think it's really, really important, as you say, to really sort of look at, you know, all of the opportunities that are available, and even being quite creative and innovative, as you say, with some of that avatar work that's really quite, you know, wow, you know, who would have thought sort of 15, 20 years ago we'd be looking at that kind of option, you know, to try and, you know, be able to support patients, you know, across communities with some of that technology. And, you know, it's really about embracing that and enabling everybody, all of the teams, or all of the CNS teams and the wider teams, to really, you know, tread new ground with innovation, or, you know, saying, you know, there might be a piece on social media, you think, oh my goodness, that sounds really good. I wonder what that might look like in our organisation for our patients. Can we sort of, you know, lift and shift, or do we need to sort of, you know, tweak it, you know, to the needs of our own community in Gateshead? But it's so exciting, as you say, isn't it, to be able to have that opportunity to be innovative, be creative. Yes, we've got, you know, quite a bit of work that's, you know, well embedded in the organisation and within specific tumour sites, but I think it's really important that, you know, we are always looking for new ways of delivering our services, and it is so exciting.
I think the challenge, though, that we can't step away from is the challenge that I think you've mentioned before there, is that we have a very ageing workforce as well. I think 3/4 of clinical nurse breast care nurses are due to retire over the next few years, and it's okay, we need recruitment, and we need to inspire those nurses on the ward to specialise into areas like that as well. But it's also retaining those nurses. I always call them, you know, our Mr. Miyagis. You know, these are the nurses who've been doing it for many years and understand the craft of it. And we have to retain them to make sure that these new nurses that are coming through get that experience, because they're just a fountain of experience, you know.
Historical knowledge. And it's so valuable that we need to transfer to our younger generation. Because when I was a nurse on the ward, surgical, that's where that passion was lit, and I got the first chance to be a CNS. Do you know what? I was a mature student. I know you can't believe it. In like university, and never thought I'd get a degree or anything like that. And I look at where we are now and what we do, and you want that passion. Because it's fantastic. I think we'll do a brilliant job.
And I think it's that passion and compassion, isn't it? You know, and that's what kind of then seeps in with patients. You know, if you've got somebody that enjoys coming to work, that has that fire and that passion, you know, patients see it, don't they? And they want to be part of that, and they want to help us. You know, I've had patients come along and do podcasts, you know, and they've helped out. You know, we do a lot of these virtual clinics, and we have patients who come on and support me, because I haven't walked in those shows, you know, I understand it, but that's where patients love the knowledge of other patients, to be able to transfer that. And again, I suppose it's partnership, isn't it, with patients, which is what we're trying to achieve. But yeah, there's challenges out there, and, you know, as you've been the lead cancer nurse as well, is there anything at the minute, you know, trying to help us overcome those challenges?
So I think, you know, touching on the earlier conversation about, you know, the aging, and being very polite, but the aging workforce, you know, it's being creative about how do we retain some of that knowledge and skills, so that for some of the nurse specialists who are at that other end of the spectrum, who are doing some retire and return, so we can retain some of that knowledge. But we're also looking at, we've done other options, such as working with Macmillan, so we've got 2 CNS development roles at the moment. They're on a 2-year fixed term with gynae oncology, so with Yvonne, and then we've got another post in upper GI as well, and that's enabling them to learn knowledge and skills around the role of the CNS, you know, to be able to, you know, have those opportunities in the future to look at having, or look, you know, certainly looking at a substantive post in the future. And then obviously thinking about other options, such as internships. So we've got some opportunity with through funding from Health Education England to have 3 internships in the next 12 months. So staff on the ward will be able to obviously look at applying for it's a day a week for 12 months to be able to come and work with some of the cancer nursing teams and various other cancer specific areas over the next 12 months. So that's given them an insight into what a cancer CNS does, and some of the pathway that a patient might experience during that time, and that might then encourage them maybe light that fire to want to become a cancer CNS of the future. So
I think
there's
that's
some options.
important, because we've taken on a lot of new band sixes, and they kind of come into the job and they get that overwhelmed. I think people underestimate the knowledge that we do have to have, and that speciality, but how long that takes to be able to build that up as well. So that internship will be absolutely amazing to kind of, like you say, there's no expectation to know everything, but to gradually build on that fountain of knowledge as well. So at least there's awareness there, we're taking the right steps as well.
I think, I mean, I don't know if this is just me, but certainly when I worked on the ward, in my head, to be a specialist nurse, it was like you already had to have that knowledge.
Yes.
So you couldn't be a specialist nurse if you had only been qualified, a couple of years. You had to be a very experienced nurse to then become a specialist nurse. So there's this idea that you need to know everything before you come into it, and so I think that probably delays people in applying because they think, I can't do that because I'm not ready for that job. But actually there's so much support within the team. So again, talking about the aging staff, but actually there's so much knowledge to tap into. So certainly for me, when I started with the breast team as a band 6, and you come in and you cannot fathom how you're ever going to learn everything that you need to know, but actually the people around you, like you say, are an absolute fountain of knowledge, and it's so important to use those and not be scared to take that step to apply to be a cancer specialist nurse, because there's support there to help you to be the best type of nurse that you can be. And I think it's so important that people understand that like you might not think you're ready, but the support's there, And
I suppose there's nothing stopping for many of the ward nurses. I mean, I know it's incredibly difficult for them, the hours that they put in, but for say, can I come down for the day? Can I just see what it's all about? And I'm sure we would take them,
absolutely.
and embrace that.
Definitely. I mean, I think just going about knowledge, we're always learning.
Oh yes.
Do you know what I mean?
Definitely.
So even
it's always changing.
And I just think in gynae oncology, the changes within the past 5 to 6 years with immunotherapies, and it's just wow. And it's always remembering we're always learning, and there's always somebody to ask for help
always
when we're not sure.
And I think it's right as well, isn't it? In what you said there, Nealy, we were all, even people see us at this point and think, well, you've got X number of years experience, we'll not labour that particular point, but we were all there at one point in our lives, and I guess every time we move into a new post, we're almost back to being a novice again. It's a collective, that collective support and encouragement and supervision, and that enabling culture to be able to allow us to be the best that we can be within the roles that we do.
Because there's no doubt about it, the job, as exciting, and fulfilling it is, it's hard. I mean, I always say, on a daily basis, we're handing over these kind of grenades of information, which that once it goes off, it has such a huge effect on not just that patient, but family members, and, their employment, the relationships you have with the people, and it's like, you end up being that buffer for some of that, and you need that kind of support around you to be able to talk and say, this is hard, and you're going from room to room where patients, quite rightly, they're on the ceiling, they're anxious, and your job is to take them off that ceiling, and give them that information and support. And I think that's the great thing is that as a CNS team at QE, we were very supportive. We've got really great leadership, and but that leadership comes from each and every one as well, doesn't it? As well, and I think and I think that's why we kind of, I suppose, bounce off each other, don't we?
Yeah. And it's sometimes where I'll maybe ring one of you for some advice, or oh God, I've got this, I'm not sure what to do, and things like that, and it's picking up the phone, and it's that support that we've automatically got there, which you're not alone.
And it's just appreciating that sometimes we do have those knowledge gaps. Again, it goes back to what Nealy was saying, is we don't know everything, and like I say, just that clinical supervision and that chat between ourselves and knowing, they can give us support with that, and different things like that. But I do think, we're an incredible team. I mean, what was it? We were one of the highest in the country when it comes to the Cancer Patient Experience Survey. But we obviously, as clinical nurse specialists, are doing something right. The Cancer Patient Experience Survey, we've always been, ranked as really high in the country for the experience that patients have when they come into our care. And I think, we don't ever assume that there's a glass ceiling. We know we can keep pushing that ceiling, and I think, like I say, the innovations that are around and the leadership, hopefully we can just keep moving. And with the help of the clinical nurse specialist day on the 26th of April, we can start just advertising what we do, and like I say, those student nurses coming into the system, and those ward nurses or anybody that's interested in knowing that they can contact us, and find out a little bit more about it. So we're obviously doing something right when you're ranked as one of the highest in the country as well. And if anybody wants to know about getting into clinical nurse specialists with cancer care, we have a stall on the 26th of April down at the ECC. And you're more than welcome to come along and chat to us, and that include some of the allied health professionals, or if you've got any of the student nurses and just want to chat and find out a little bit more about us, everybody is welcome. So I'm sure we'll see loads of it over the social media, over our comms, but it's another great day, and it's again just highlighting the work that we're all doing. So thank you, ladies, for coming today. It's been a pleasure, and
thank you.
Looking for the 26th of April.
Thank you.
Thank you.